Hi, my name is Amy. I'm a technician here at Countryside Animal Clinic, and today we're going to talk to you about our Fit for Life program featuring the metabolic diet. We have CC here today. He's an 11-year-old male neutered cat, and he's a little bit overweight. How we can tell that is you cannot easily palpate his ribs. He does not have an obvious waistline, and he has a little bit of a pouch that hangs down right here. So we want CC to be healthy and live a long, happy life. So we're going to address this issue. Today we'll go ahead and make some measurements of his head circumference, his chest circumference, his front leg circumference, his front leg length, his hind leg length, and his body length. That will help us to know exactly what CC should weigh for his body shape. Okay, so first we're going to do the head circumference. So we measure around the widest part of his head, and he's right at 25 centimeters. And for his chest circumference, we're going to measure at the girth at the level of his heart. It's going to be right here. We want to make sure these measurements are accurate so that we're sure that we're getting an accurate reading. So he's 50 centimeters for that. His front leg circumference. Nine centimeters. His front leg length. 16. His hind leg length. And CC's being very good. 11 centimeters. And his body length. All the way from the tip of the nose. I know that's funny. 54. So this will give us a good starting point to see what he should weigh, and we can go from there. So Hills has developed a program for us to put in these measurements, and it will actually, it takes into account his breed, his age, his current weight, all of those things, and it will formulate a plan for us of how much weight he should lose over a gradual period and how much food we should be feeding him each day. So I have CC's name right here. I've selected cat. He is a male, and yes, he is neutered. Today his weight is 17.8 pounds. He is 11 years of age. And he's just a domestic short hair. Okay? And like I stated before, he is overweight, so I'm going to select that patient is overweight, and we're going to calculate a healthy weight for CC today. So now it's calculated that his ideal weight would be 11 pounds. So now it tells us what his body fat percentage is. So he has 50.1% body fat. The program also shows us that CC is at serious risk for increased physical injury, arthritis, diabetes, reduced mobility, cancer, shortened life expectancy, respiratory disease, kidney disease, pancreatitis, fatty liver disease, and bladder stones. So we don't want any of those things to happen to our CC, so we're going to get this under control. Now the program's going to tell us a weight loss schedule. It already puts in what his ideal weight is going to be and how many calories he can have. CC eats only dry food, but Metabolic does have dry as well as canned and treats. So I'm going to select the dry food and I'm going to add that to our plan. Like I said before, it does include a wet food, but he doesn't eat wet food, so we're not going to include that today. We can select treats because I'm sure that CC would like to get a treat every day. So I'm going to go ahead and add that to the plan. So it calculates that CC can have 5/8 of a cup of dry metabolic weight solution per day, and he can have 2 treats per day. It estimates that in order to feed him this diet, it'll cost about 50 cents a day. And I'm going to go ahead and apply this for 6 months because we're going to go ahead and do it over a long gradual period. At this point, we go ahead and select that we're going to include in his report his feeding plan, his weight loss schedule, and his body fat index chart. And we can review this all together in one report. So it just basically summarizes everything that we just went over and calculated specifically for CC. And it explains all of the risks that he's at, and it explains what he's at risk for. And it gives us his weight loss goal plan, what he should be losing each week. Okay, so now I'm going to talk to you a little bit about the Metabolic diet. Metabolic is a prescription diet that's formulated by Hills. It's brand new. It just came on the market this year in 2013. We've had wonderful success rate with it. It's highly palatable. Most cats that are really finicky and picky, they love it. They eat it right up, so we've had great success with that. It does work on a genetic level. What we've found is that a lot of the animals, both cats and dogs, do have a metabolic disorder. The ones that are overweight, it's not just that they eat too much. They have a metabolic disorder, and they don't know when to stop eating. So, and their bodies always tell them, you know, that they're hungry. So the great thing about the Metabolic diet is it works on a genetic level. It helps their metabolism to work more efficiently, and it takes away those constant hunger signals so that the pet isn't always hungry. It helps with the clients because they feel like they're not sacrificing anything with their pet. They are able to give them both dry, canned, and treats. So they're not missing out on any of the special treat time, the bonding that they have with their animal. They can still offer those things with their pet. So basically, I talked to you today about CC and the metabolic food with our Fit for Life program that we have here at Countryside Animal Clinic. It is offered for both cats and dogs, and we'd love for you to come in so that we can discuss this in a more detailed manner with you. Thank you for listening.